All right, we'll talk about the pipeline. This is a cartoon that I use to show the components of the immune system and the pathogenesis of lupus. And we are targeting most everything that you see on this particular slide. We're targeting the plasmacytoid dendritic cell because it is a mass producer of interferons. And there are a lot of different ways to target that plasmacytoid dendritic cell, as well as other ways to target interferons. Even though the LUNAR and EXPLORER trials failed many years ago, we still believe in B cell directed therapies, and there are a lot of potential targets on B cells. And everyone that you see on this slide has been, is, or will be targeted for lupus drug development. We still believe in depletion of B cells with antibodies to CD20. In fact, the obinutuzumab data generated in the Nobility lupus nephritis trial were very robust, and that's being pursued now in a phase 3 trial. We heard about iberdomide, which affects the nuclear transcription factors that you see here, IKZF1 and F3. And our foray into BTK inhibition didn't fare so well with 2 drugs, but there's still several other programs that are targeting BTK. We'll go back to the right-hand side of this slide. I talked about targeting BLyS, but also there are programs using recombinant tachyreceptor, which binds both BLyS and APRIL. In fact, telitacicept was approved in China in March of 2021 for systemic lupus. And we've become like oncologists. We're now targeting plasma cells, long-lived plasma cells, which have evaded our treatments with many of our drugs, including rituximab. And there are different ways to target plasma cells. The tachyreceptor will do that. Proteasome inhibition, and there's a drug, KZR616, which is in development for lupus nephritis. And then antibodies to CD38. There have been some published anecdotes, but there's also a phase 1 study that's finishing up with an antibody to CD38. Let's not forget about T cells and their interactions with B cells. A lot of different targets. The ones in orange are some of the more popular ones that have been tried. There is ongoing right now an antibody to CD40 ligand for systemic lupus, antibodies to CD40 for lupus nephritis, and the list goes on. If you look at the far right, there's a lot of excitement about not inhibiting interleukin 2, but actually giving interleukin 2, called interleukin 2 restoration, giving low doses of interleukin 2 to boost T regulatory cells. So it's a very exciting time in lupus. There are a lot of different targets. Here are more targets, cytokine targets. I talked about interleukin 2 restoration, and unfortunately, we just heard a couple of weeks ago about the failed baricitinib phase 3 trial or trials in systemic lupus. But there are several other programs that are looking to inhibit the JAK-STAT signaling pathway. And here's an iconic figure. You can make your designer inhibitor. Just figure out what molecules you want to inhibit. And then on the left, you pick out which signal transduction molecule you want to attack.